Committee for giving us such a detailed report that can guide this House. Honorable Speaker, having gone through the report, there are things that we cannot allow to continue in this country. Number one, a report that has details of things that has happened for the last 26 years is not something that we should be excited about, because we've had different parliament. 12th parliament was there, 11th parliament was there, 10th parliament was there, and the reports would have been presented and tabled, and issues that are of concerns would have been dealt with. But unfortunately today we are seated here talking of reports of about 26 years and revealing different gaps that are there and the challenges that we are going through as a country. Honorable Speaker, we should be concerned of this and also come up with the way forward so that even as we continue working on this report and seeing how best we can handle measures, serious measures to control the bad practice that is there should be put in place so that we can be able to have controls of finances and also encourage the different institutions to be more effective. Honorable Speaker, one of the observations that the committee made is lack of ownership of documents on land and buildings. When the land does not belong to this institution, when the building does not belong, then you are sure of poor management, lack of commitment, and poor work performance. Honorable Speaker, we are Kenyans and we know how land issue is emotive. And the fact that these institutions have challenges with that, because it clearly says the committee observed and noted with concern that Kenyatta National Hospital, Kenyatta Medical Supplies Authority, KEMSA, and Kenya Broadcasting Corporation, KBC, did not possess title documents for the land and buildings in their occupation. This is a big failure, and something needs to be done, and a serious attention needs to be given to this so that at least we can be sure of the ownership. Honorable Speaker, again, the report says that for various parcels of land, some were illegally and procedurally carved out and registered in the name of private developer. This should be a matter of concern to all of us. How can we say that Kenyatta National Hospital is registered under the name of private developer? The corruption that we have been talking about since independence seems to be very real and coming out, because when we talk of corruption, it is not only cash, it is not only money-based corruption, but the issue of land and other things is also included. In this matter, I think this House should be getting concerned of what is happening. Again, Honorable Speaker, the other serious concern that the committee has observed is delay in availing documents to the Auditor General. I think these institutions is where serious corruption is taking place. How can they delay in giving their documents to the Auditor General for the audit? The committee observed that some accounting officers did not avail complete and reconciled financial and accounting records. This is very serious. Why should we have the officers who are unable to avail reports on time? Again, Honorable Speaker, my time is almost up. Poor governance and weak internal controls. It seems as if they have serious control problems. There is a serious plan in coordination of poor performance, corruption, and everything. How can they not have internal controls in terms of accounting? And how can they have, how can they not have board directors in place. I know that can be even beyond them, but Honorable Speaker, serious issues have been brought out. Our young people are suffering. We cannot continue this way. And I say that I support the report, but we must take serious action so that we can salvage the situation. Thank you, Honorable.